name is Jennifer Corson, and I'm giving a speech on the new findings in my field, which is registered nursing. How would you define nursing? Is it a profession? Is it a trade? What job duties do a nurse perform? What job duties did the first nurse perform? And how has nursing changed over the decades, and even over the century? Let me explain the answer to a few of those questions. What is nursing? The old nurse, the first nurse, was Florence Nightingale, the lady with the lamp. The one who started the modern day nurse in her birth in 1820 was the beginning of her lifelong endeavor of meaningful healing through the environment and nature. Nature, the manifestation of God, alone cures. What nurses has to do is put the patient in the best condition for nature to act upon him. She defined nursing as a profession, a trade, a necessary occupation, something to feel and employ all my facilities. I have always felt essential to me. I have always longed for, conscientiously or not. The first thought I can remember, and the last, was nursing work. She healed through light, wind, cleanliness, and love, and spirituality, and her mission to God was nursing in the time of war. After Florence and upcoming age nursing were standing behind the doctor and waiting for an order. No critical thinking skills, no real scientific knowledge base for caring and nursing. The new nurse is hard to come to one definition. Because nursing makes up so many other trades and values in this day and age. It combines many jobs into one and is the bulk of the flow of patients' stay in the hospital. They are the organization of patient care. Not only do they heal with basic care of cleanliness and light, but have an in-depth knowledge of human anatomy and pathophysiology. The nurse, and nowadays, has an approach of suggestions to offer to the physician when calling for orders. Parker and Smith's Nursing Theories 3rd edition says, nursing is a profession, discipline, a field of study focused on the human health and healing through caring. The knowledge base of the discipline consists of diverse components such as nursing, science, art, philosophy, and ethics. Nurses are teachers, caregivers of the patients and the families. They're the secretaries, the middleman between the doctor and the patient. The other disciplines in the hospital organization of care for the patient as well. There are respiratory therapists, speech therapists, occupational therapists, nutritionists, wound specialists, IV specialists, case managers, social workers, and physicians. But most of all, nurses are the patient's advocates. We are the ones that coordinate the care for the patient in between the physicians and the patients. In order for the complete picture to be present, all of these interdisciplinary needs has to come together and viewed through the nursing lens, complete the puzzle of the patient's care and healing. Now, the magnet status is a big thing that all the hospitals now are wanting. A magnet hospital is stated to be one where nursing delivers excellent patient outcomes, where nurses have a high level of job satisfaction, and where there is a low staff nurse turnover rate and appropriate grievance resolution. Magnet status is also said to indicate nursing involvement in data collection and decision-making in patient care delivery. The idea is that magnet nurses, leaders, value staff nurses, involve them in shaping research-based nursing practice, and encourage and reward them for advancing in nursing practice. Magnet hospitals are supposed to have one communication between nurses and other members of the healthcare team, and an appropriate personal mix to attain the best patient outcomes and staff work environment. The American Nurses Credentialing Center says there has to be a theoretical model for practice now for nursing for hospitals to seek the magnet status, adding back into care the holistic approach. Why? It gives community a safety net of providing good care to their community. In order to provide good care to have the magnet status, there are much need for a higher education in nurses. Nurses with higher education, meaning the baccalaureate nurse. The baccalaureate nurse has a broader meaning of the nursing field of study and understands that the evidence-based practice can achieve these better patient outcomes. They can have advancement in their career as far as management and teaching positions, higher pay rates, more respect from patients, and more reliability for patients and families. With healthcare reform and Medicare changes, the need for more advanced level nursing, such as nurse practitioners, will be on the outlook. Now, with the understanding of the changes of nursing profession over the years, you can see the development of the nurse, moving from the broad approach of standing behind the doctor and treating people with basic care and needs with holistic view, meaning mind, body, and spirit, to a much more scientific approach and a variety of responsibilities to providing the best care. Although along with the old nurse's holistic care approach, no real scientific base, if we add the holistic approach with the new nurse's advanced knowledge base, we can have a large number of hospitals with magnet status and a community well-rounded with great expectations of quality care.
Page 2.